Hello and welcome to Dignity Health Social TV. Today we're talking to urogynecologist Dr. Mooney. Doctor, thanks for hanging out with us.
Thank you.
So you are a urogynecologist.
That's correct.
What is that and how does that differ from normal gynecologists?
Well, urogynecologist or subspecialist in female pelvic medicine and reconstructive surgery are simply focused on issues of pelvic support and incontinence. That is support of the pelvic organs such as the bladder, uterus, rectum, and vagina, as well as issues of incontinence or leaking of the bladder or the rectum. We don't deliver babies. We don't generally do much general gynecology either. We're specifically focused on dealing with these issues, and we bring a lot of skills to the table that general OB-GYNs and urologists are not trained to perform. And we look at things a little bit differently. We look at the pelvic floor as a global system rather than just a bladder or just a uterus or just a rectum. And all these organs are connected and work in concert with each other in a very complicated way. So when something's not working, it's usually a little more complicated than it appears to the eye.
Sure. And so would someone need a referral to see you guys? How would that work?
No, that's a good point. Women can see us directly. We're available just as you would go to see a gynecologist. You can call the office of a urogynecologist and schedule an appointment. We like to work with our primary care physicians. These physicians will be seeing you over the term of your entire life, family physicians, internal medicine physicians, and we work closely with them and helping them. And we'd like to encourage those physicians to be asking their patients about this very common and very intrusive issue in women's lives because they have help. They don't have to deal with it alone.
What might be some symptoms that someone might be experiencing that would lead them to think, oh, I should probably call a urogynecologist?
Mm-hmm. Any feelings of pelvic heaviness or bulge in the vagina, difficulties with leakage of urine, that is any loss of urine or stool that you're not planning on and that you don't control. And that's as simple as running, jumping, it's trampolines, anything that would cause you laughing, sneezing, things of that nature. This is how it usually starts.
And so for women of any age, really,
That's
is what
correct.
you would...
We deal with adult women, so women typically, it starts in most women's 20s, 30s, and 40s, and becomes a much more progressive problem through menopause and postmenopausally.
Are there solutions or preventative care that someone could be educated on?
The great part about this is that the solutions that we have are almost all minimally invasive and low impact. That is rapid recovery. The surgical issues as it relates to incontinence are there, but they're not onerous. They're not things that are going to lay you up for a long period of time. They're not going to change you in ways that people would consider unreasonable. We focus on women's lives and getting them back to their activities. So you're not expected to worry about how much you lift afterwards and things of that nature. We're really geared towards returning women to normal activities rapidly.
So women that may be experiencing this, it's not uncommon.
Right. At least 1 in 4 women.
But it's also, you shouldn't just think it's normal, right? Yeah. And so they have opportunity. There's people out there like yourself wanting to help and wanting to champion that.
And working in concert with their primary care physicians to keep them healthy. Yeah.
That's great. Doctor, thank you. Thank you so much. Thank you for watching Dignity Health Social TV. For more information, you can visit mercy.org.